Hi everyone, welcome back to my channel and you're watching The Brown Feminist. In today's video, I want to talk to you guys a little bit about advanced certifications and licensures to further advance your career in clinical research as a CRP. Now, this video is mainly going to focus on the growth opportunities for people who have already landed their first or second role in the field of clinical research. So if you have 1 year, 2 year, or more of experience within the clinical research industry as a trials assistant, clinical research assistant, and so on, and you now want to figure out how to become a coordinator, an associate, a trial manager, a program manager, and so on, then this video will be perfect for you. So without further ado, let's get into it. So the first couple of things I want to talk about is to focus on your own strengths and figure out which aspect of clinical research or clinical trials you want to specialize in as you're rising above in the ranks. Now, if you are somebody who comes from a clinical background, such as you are an IMG, like an international medical graduate, or you're somebody who's like an RN, so some kind of a nursing background, or a physio, kinesio background, or other kind of clinical background that you have a licensure, then definitely advancing that licensure can give you an added edge in clinical research. So by that, if you came in from RPN and you want to become an RN, if you are an RN currently, you want to work towards a nurse practitioner program. If you are an RN and you want to get some advanced practice certifications, which can further give you the ability to manage the trials in a more elaborate way, where you can take on more responsibilities from the PIs of the program. For example, if the physician PIs are currently doing a lot of the procedures, a lot of the assessments and interventions, and you feel that you can take off a load by discussion with them, by doing an advanced practice certification or licensure, then that's definitely one way to go. Number two is if you want to go down the path of becoming like a more adept trial coordinator and manager, and you want to do a little bit more of regulatory side of things and project management side of things. So for this, there's two kind of really good certification pathways that I personally have learned about and heard from by being in this industry for so long, and one of these I'm actually pursuing myself. So these would be doing a CCRP, so becoming a certified clinical research professional. One of the main bodies in North America that gives out this exam and licensure is SOCRA, SOCRA. The SOCRA CCRP is very well known in the clinical research industry and can help you secure a coordinator or trial manager or program manager role. At the same time, if you want to keep yourself a little bit broad in your ability to do project management, even outside of the clinical research environment, but within the healthcare industry as a whole, and you want to, invest that time in doing more generalized skills and strong foundation in project management, then working towards a PMP or a project management professional certification and licensure is another way to go. Now, the PMP does require you to have a few years of project management, whether as a coordinator or an associate or a program manager already. Usually you can pitch it to show that as a clinical research coordinator, you have done many project management functions. At the same time, there can be additional coursework you can take and other requirements that you can meet in order to qualify to take the PMP. It's a little bit similar similar to do this for CCRP SOCRA, where you just need your standard like 2 years of full-time work experience, or for part-time enough hours to meet the full-time requirements as a clinical research person in any kind of role, as long as you have like formal documents to support that, or you have reference letters from your PI supporting that you have done those 2 years of work. The PMP is a little bit more specific in the nature of what kind of work you have done, but both these certification will open many doors for you. CCRP SOCRA is of course very well known in the clinical research industry, while the PMP is widely known even beyond clinical research in the broader healthcare industry, in general project management, in many different fields of work. So if you want to keep those doors open and do the PMP, and eventually you can have like other options as well in health administration and other kind of pharma administration, that's an excellent way to go if that's where you see your career path going. Now, moving on to our point number 3 is what other things you can do to advance your career in clinical research. Apart from these licensures and whether they're clinical or project management, you can of course go back and do additional diplomas or degrees. Some of these advanced degrees can look like a master's degree in epidemiology, clinical epidemiology, public health, population health, and global health. It can look like a PhD, which can get you much farther ahead, but mostly within an academic setting where you can actually work towards being a PI yourself or being an analyst. So there are branches of clinical research. Now that you've had 1 or 2 years of experience at the site level, you can choose to stay in more of the clinical side of things, or to be in the management side of things, or to go into the more analytical side of things. Especially in Canada and the US, there is now increasing amount of clinical research being done that's not necessarily at the trial side of things, not necessarily testing drugs or testing processes with patients, but there's work being done with health administrative data, which, because the data is also human subject data, it is still technically considered clinical research. For these fields of work, you would really benefit from a degree in things like clinical epidemiology or public health, where you can learn advanced statistical models, developing like different kinds of algorithms for diseases, and predicting diseases, or actually changing the guidelines of how diseases are screened and prevented, treated, and the health burden system can be reduced on the health system. So things like that. So if that's also a way that you want to eventually work towards something a little bit more technical, and more analytical, you're somebody who loves computers and the technology side of healthcare, and you want to work with large data sets and do that kind of work, there's also a huge branch of work that you can do, but you would need some higher education for that. So I hope this short video has been helpful to you guys to kind of set up the path of what kind of decisions to make once you are 1 or 2 years into clinical research in any capacity. It's time to start thinking if you want to continue moving up in project management, you want to continue moving up clinically, or in a more analytical role. There's also lots of data management and other opportunities. Of course, everything cannot be fit into one video, but if you enjoyed this content, have more questions, don't forget to give the video a thumbs up. Let me know your questions, comments, and thoughts in the comments below, and don't forget to subscribe to my channel for many more videos that will help you in your career path. Until next time, this is the Brown Feminist. Bye. Hey guys, before you go, don't forget that I do offer one-on-one career counseling services in clinical research. So if you do feel that beyond the videos and the emails where I answer all of your questions, you need a little bit more of hands-on support, you're not getting those interviews and you're not really sure why, or you just don't know how to handle certain questions because of your, you don't have all the experiences, but you know that you can do the job. If you need some additional help in resume building, cover letter design, interview prep, or just general career consultations, I do offer this service now live. Find out more by clicking the link below. I have a whole video where I explain what services I offer, and there's a form there if you would like to sign up. Until next time, this was the Brown Feminist. Bye!